As someone who's been working in the same place for most of their career, I feel like you have a unique ability to kind of be the constant in an ever-changing environment. You have the knowledge of what's been in the past versus where we are now in terms of nursing practice. And, with that in mind, I'm curious to know, in your opinion, what you think some of the most notable changes have been in nursing over the years.
Well, that's a really good question. I think it changes. I think nurses have a little bit more autonomy, definitely more autonomy than they did before. I see the nurse as the patient, is patient-centric. And like you said before, being the switchboard, everybody comes to the nurse.
Yeah.
And the nurse is really directing care. That's the way I see it. I think we're more collegial than it used to be. It used to be more physician dominant. I don't see that. I see that changing.
Yeah.
And I think we're all taking care of the patient. It's a team.
Yeah.
So
it's
if
more
I had
team-oriented.
It is more team-oriented. And I definitely think that's a big change for us. And that's happened probably over, I would say, 15 years. That's been happening.
Okay.
I also think the complexity of patients is astounding.
If you used to be very cut and dry, like, this is the problem, we fix the problem.
Yeah. And patients, I know everybody thinks that they take care of the sickest patients, but patients are sicker. I mean, they have a lot more comorbidities. And so their care is a lot more complex. And so you may be on a neuro floor, but you're taking care of somebody with peritoneal dialysis and they have diabetes, they have an EVD on the floor or a lumbar drain. It's not your laminectomy that comes in, has surgery, and goes home. Those patients are outpatient now. Those patients may spend the night, but they're home the next day.
Yeah.
Those aren't the ones that stay in the hospital. So the patients that stay in the hospital are a lot more complex and have a lot more needs. And I think nurses have to be a lot more educated and supported to take care of these complex patients.
Yeah. That's really interesting to know. I mean, I remember, you hear, as a younger nurse, you hear about, stories of nurses taking on like 11 plus 12 to 15 patients. And I think about, like, how I couldn't, but I think that there's a lot more, complexities. I feel like now that there's a lot more that we are required to think about and do in our day to day. And I guess that makes sense that they probably, realize that and cut down the amount of, safe patient care.
Absolutely. And not to take away from those of us that did take care of 30 patients or however many patients, you didn't have time to actually really look at the patient, right?
Yeah.
You were checking boxes off. I mean, that's the way it was. And, I think we gave good care, but we didn't check labs. We didn't have time to check labs. So what does that mean? If we're not checking labs, or, an intern who has also the same amount of patients. So I think the care is better because we aren't taking care of so many patients.
Sure.
And I think I won't even try to get into like how you figure out staffing. I think that is such a controversial subject. But I think it needs to be one that the nurses drive and no one else does.
Yeah. I have kind of, going into the ICU setting, but having the acute care background, the busyness in the day is very different. I mean, you really trying to provide really great quality care to 4 people is difficult. I mean, it can be difficult, especially with complex patients and patients that can't get up on their own and they can't eat on their own. I mean, neuro-specific patients are very, it's amazing when you can't get up on your own and you can't do those like normal activities of daily living. That takes a huge chunk of time out of your day to do all
It's a hard workload. It's a big part of your workload, right? And then assessing the patient and also figuring out, should I give this drug or not? I mean, right? That's part of like what you're making those decisions of, I don't think I should be giving this. Now you're going to talk to your NP colleague or your physician colleague, but you're the one that's bringing it to them, right?
Yeah. Yeah.
So
right.
That's part of like, and then all the other things that go along with it. You just think of a patient that has DKI and with that one patient, and that's one of your 4 patients, that's a lot of work.
Yeah. Yeah, it is. It's a lot to remember, and it's a lot to you have the responsibility and the accountability to be autonomous and make the right decisions and communicate them to everyone else. But also in that moment, it's like, okay, this is ordered at this time, but this doesn't seem right to me.
Right.
Instead of just like, well, the doctor said.
Right.
So that's, I could see that being a big change.
And also, I mean, let's just bring it into neuro, okay? Who's at the bedside and sees this patient? Nurses, all right? Mm-hmm. Their neuro patients can have such subtle changes that if the neuro nurse doesn't pick it up, it's not going to be picked up, right? Yeah. And like, honestly, it could just be from someone who knew that they were in, Virginia, like 2 hours ago and now doesn't. And somebody could like dismiss that as that they're tired or whatever.
Right. Pain meds or,
Yeah. And if you're not bringing it forward to the appropriate people to start investigating this, then it's not going to happen.
Yeah. And communication is so key.